What do you get when you add an isolated fortress, an alluring visitor, and a twisted love triangle? The Dance of Death at Steppenwolf Theater, which folks are calling a masterclass in marital warfare. Plus, this tour de force brings together 3 generations of Steppenwolf ensemble members. I'm talking about Cliff Chamberlain from Broadway's The Minutes, Catherine Irby from Law & Order, and Steppenwolf co-founder Jeff Perry from Scandal. The Dance of Death begins January 29th. Get tickets now at steppenwolf.org. One of my favorite times of the year is almost back, Chicago Theater Week. Enjoy value-priced tickets to an array of productions from February 5th through the 15th. For $30, $15, and in some cases even less, you can enjoy great shows across Chicago's dynamic theater scene. Productions range from comedies and dramas to musical and improv shows, so trust me, there is something for everyone. Brought to you by the League of Chicago Theaters in partnership with Choose Chicago, Chicago Theater Week has been bringing audiences together for 14 years. Visit chicagotheaterweek.com for more information on shows and to buy your tickets today. Today on CityCast Chicago, last year Cook County recorded its fewest fatal opioid overdoses in a decade. We sit down with the West Side organization that teaches us what it means to be on the front line of this work, and we learn how to use the overdose reversal medication popping up in sites across Chicago. It's Thursday, January 29th. I'm Jacoby Cochran, and this is what Chicago's talking about. I am here off of Pulaski and Lake, just steps away from the Green Line station at the West Side Heroin and Opioid Task Force's latest office. I'm sitting down with Richard Vargas and Sin Q Adams. Y'all, we appreciate y'all making time for CityCast Chicago today.
It's our pleasure to be here.
So in a recent interview, your organization was quoted as saying that this corner where we are currently sitting having this interview is the epicenter of Chicago's fentanyl and overdose crisis. Why this corner?
Well, technically the corner, but actually technically the area.
Okay.
So one of the reasons why, I mean, we refer to this area as the Heroin Highway, and I absolutely hate that name.
Yeah, I've heard it throughout my life.
So there's 2 reasons. We're close to the 290 and the Green Line. So what happens is people can get their product or come from the suburbs, come through, get their products, and return back to where they came from. So it's kind of like that whole express route of coming here, picking up your things, and going back. Or get on off the expressway, get what they need, and then head back to where they're going.
When you talk about prevention work more broadly, what are some of the type of resources the task force provides and some of the intervention work that you all do?
So some of it is training and education. Some of it is actual street engagement and street work. And the other part of it is working with other agencies and incorporating our services, incorporating things that we do on the street and incorporating that with other agencies as well. So we have different kind of lines of work that we do.
So if you're thinking about training people, for example, what does some of that look like on a day-to-day basis?
Well, if we're talking about street training, so a lot of our street training revolves around this. This is called Narcan. Narcan is a opioid reversal medication. It's actually kind of technology if you think about it. So in this area, there are a lot of heroin usage and a lot of, opioid, but heroin, fentanyl, and other things that might be in the products that we may find in this area. And we actually go out in the street corners around in the community all over the West Side. And what we do is we train individuals on the use of Narcan, how to use Narcan, and then also we train people on to recognize the signs and symptoms of overdose as well. We find that those two have to go hand in hand because the Narcan is what's going to save your life. But if you don't know a person is having in an overdose, then how would you know to use the Narcan?
For us, this is not a job. It's what we do, right? So walking the neighborhood is what we do. You got people on the corner all day, right? For whatever reason. If we're on the corner, we're vigilant, we're looking, we're listening. We use the corner, we use the community. The community is what lets us know what's going on. If you see a lot of people moving in one direction, there's something happening. If you don't see people moving, there's something happening. If it's too much traffic, There's something going on. So we're trained to look for things that the normal person won't look for, right? If I see someone walking up the platform, I want to make sure I see them get on to the train, right? Because we had a gentleman one time, he walked up to the platform and we didn't see him anymore. Why? Because he was upstairs. He had overdosed. And by the time we got to him, it was too late. And he actually died in my arms. So that's something that'll keep you very aware of your surroundings, and not even just the surroundings, the environment. That's how we're trained to spot someone who's in need of our services. Not even just an overdose. That can be someone who needs to go to a shelter, someone who needs detox, someone who needs treatment, whatever it is. We're trained to look for those things. I'm not looking at you and say, well, Jacoby's wearing glasses today, he can see. No, that's obvious, right? Jacoby may need someone to talk to, and you won't be able to know that unless you're really paying attention. So besides saving lives, we're also just shoulders. And being a shoulder can sometimes lead to a person getting resources. It can lead to a person getting just a weight lifted off of themselves by having somebody to lay it on.
So we also do use data trackers. Okay. So the city of Chicago provides us with data on areas where there are high episodes of overdose. So what we do is we break that data up, and that's how we determine what areas that we work around. And then also another piece of how we kind of do our job is we hire locally. So we have a lot of individuals that we do on our team, that we have on our team that live in the community, that live around the area. So they know kind of like, oh, this area, hey, around this area. So they can kind of also help pinpoint. And then they also know individuals that can help us pinpoint areas that the city, we get our data from the city of Chicago. So they may be able to point out areas that the city may not know about. And then also the individuals that work on our team, a lot of them are individuals who may have been in recent use. So they're individuals who may know a little bit more in depth than I may know, or than somebody else may know, because they're a little bit more in tune with some of the things that, things that might be going on in the community. So with all of that, and then what St. Q said is that we also kind of listen to the street. You know, we have a lot of individuals that we work with who we see every day, and then they kind of tell us, hey, blah, 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 you guys should try this area over here. Or, individuals will come out, like say for instance, even if there's like an area that we're working and there's a shooting in that area, people will come up to us and say, hey, you guys, not a good idea to work over here today. And so we listen to that. So we try to listen to the community.
I mean, building off of that, how important is building trust for, our entire lives when we talk about people who are, struggling with substance use? This is something that is criminalized, but it feels like we're starting to talk about this through a public health lens. Yeah. So how important is building trust when, people are afraid they're one step from having the police called on them?
I think it's about familiarity, because the faces that people see on the street are going to typically the faces that they'll see every day. And like I say, it helps when you have individuals that that live in the community. One of the things we do, we do make referrals to treatment programs. We do warm handoffs, helping people maybe get to programs that help them get stabilized on medication or get stabilized with their health issues, helping point people to other avenues of treatment, such as medication assistance, using Suboxone or methadone, things like that. So all those parts kind of come together and they work together. So we may have people who are homeless out there. We may have people who are as St. Q said, that, just need someone to talk to. We have a person that we see on a regular basis that, he's been struggling with substance use disorder for a while. And if you ask him about going to a treatment program, he'll say, well, I've been to every program. So why would I want to talk to him about program? I'll just say, I want to see who you are. I want to check in on you and see, hey, did you need anything today? Hey, did you eat today? How's it going for you today? Things like that. And I believe if we take that reverse on that one day he might say, well, these people care about me and maybe I can try this again,
Where does the task force get its resources from? Do they flow from donations from the city, the state? Is it a combination?
So it is a combination of things that we get. So we do get some of our funding. We do have a couple grants that we utilize. But this right here, we have a partnership with the state. So the state provides us with the Narcan. So we get that part. And then the city of Chicago provides us with some of the other material they need. So we have various grants, and then we also have support from our funders and things like that. So that's where we get a lot of the material that we utilize to do the work that we need to do. And then we have a couple of grants that we work from to help us allow us to pay staff and things like that.
Overdose deaths spiked during the pandemic era in 2022, and fortunately, in the year since, we've started to see those numbers come down. What's driving these downward trends?
Well, let's look at what made the trend go up.
Of course.
So what happened with the trend going up was, if you think about COVID, what was going on during COVID? Things were in shutdown.
Right.
So if things were in shutdown, what was shut down? So people's ability to go to treatment programs, detox programs. So you didn't have individuals who were able to have access to going to treatment or access going to detox or going to getting assistance. So that's one of the reasons why the numbers went up. And then also a number of reasons why we're going up. When you think about drug usage or substance use disorder, it's environmental. So if you think about what's going on in the world, it's creating anxiety, it's creating other social factors, job loss, exactly. So it's creating all kind of other social factors. And one of the things that I've studied is that when other environmental factors come into play, a lot of times individuals their usage can go up. So I'm not saying it does, but it can, because you think about it, when we're trying to figure out how to eat, how to survive, how to pay bills, how to stay living where we live. And when those things kind of become complicated, a lot of times it creates more anxiety. It creates more.
I know a ton of people who were drinking more, who were smoking more, who were eating more, or whatever the case may be.
So again, I'm glad you normalized that, because it's not just drug usage that went up. A lot of things went up. More people were cooking. More people, a lot of more babies were being. So a lot of things were on the rise during COVID. And I don't want people to stigmatize only substance use disorder or people who are using. A lot of things were going up. But in this case, we needed those treatment programs, and we weren't able to access those things. So now you have individuals who you might experience in the community more overdose deaths because there were no places for people to go during that time. So that I believe that's a good part of the reasons why.
Do these declines feel significant to you? Do you feel in your day-to-day work that you're coming across fewer overdoses, coming across fewer people losing their life in this work?
Well, I think part of the reason why is because of Narcan. I mean, we've been saturating Narcan on the streets since 2019, and it's been we believe we got a report in to show that there was a drastic reduction in overdose based on the fact that Narcan is more on the street. One thing that we can't do is we can't let off the brakes. Yeah. My guy Sink Hugh, he's a military guy. So I asked him this question the other day. I say, when you are fighting in a war and you have your enemy beat, what do you do?
Keep beating them.
You keep on going, right? You keep on going. You keep on fighting. You fight more. And with this work, we can't relax and say, "Oh man, the numbers are going." No, we need to keep on. This is our enemy that we're fighting, and we need to keep on the fight. And we cannot slow down. We have to speed up. And when we have to the point where there are no more opioid-related deaths or opioid-related use, then maybe.
All right, so picture this. You are hearing a world-class piano performance. I'm talking top of the line, some of the best players in all of Chicago, live in what used to be a 7-Eleven. Yes, you heard that correctly. That is the scene at the checkout where Access Contemporary Music is hosting a solo piano spotlight series. And they want to be clear, no tuxes, no stuffy concert halls, just some electrifying playing. And get this, tickets are just $20. And if you like Kobe, that sounds cool. That sounds like a great date night. But you also mentioned 7-Eleven, so for some reason, all I can picture is a slushie in my hand. Well, luckily they got that too. In fact, you can sip a Manhattan slushie or a non-alcoholic beverage of your choice. So you getting a world-class piano concert in an intimate setting with a liquored up slushie in your hand. Come on, what are you waiting for? Shows are Sunday afternoons, February 8th, 15th, and the 22nd, and March 8th at 4116 North Clark Street. And you know what? I'm gonna do you one better. Go on, throw in the promo code PIANO for 20% off tickets. So you're finna get all of that for $16. Come on now, get yours today at thecheckout.org. That's thecheckout.org. Dear CityCast listeners, today is going to be a good day, and here's why. Dear Evan Hansen is coming to the Paramount Theater in Aurora. If you've got any theater folks in your life, you have definitely heard them singing this soundtrack before, and for good reason. 6 Tonys, a Grammy for Best Musical Theater Album, national tour after national tour, and a story for every single person who just wants to be seen. A little white lie becomes this enormous blizzard of untruths, taking lonely, anxious teen Evan on a wild journey towards love and acceptance, even when you make mistakes. Catch Dear Evan Hansen February 4th through March 22nd at Paramount Theater in Aurora. You do not want to miss this deal. Get your tickets today at ParamountAurora.com. If you're sitting in your crib uncomfortably cold, you might be thinking, I am sick of these old drafty windows. You love to get new ones, and you imagine yourself warm and cozy even when the snow's coming down, but you don't really want to pay a fortune. Well, that's where Window Nation comes in. Their prices are always low, but right now, when you buy 4 windows, you get 4 more for free, and you might be able to do your whole house. Plus, you get them with 0 down, 0 monthly payments, and 0 interest for 2 years. And all the windows come with a lifetime warranty, so you know you'll have cozy Chicago winters for years to come. Don't wait. Schedule a fast free estimate now at windownation.com. In so much of this coverage, I feel like we don't always pay enough attention to the practical questions people might have around opioids and overdoses. So let's just start here. You know, I'm looking at this kit, drug checking with fentanyl test strips. For people listening, what exactly is fentanyl?
So fentanyl is on the street is considered a downer. It's 100 times stronger than heroin. And for the most part, it's illicit on the streets. We can say that. You know, they have fentanyl in hospitals.
Actual fentanyl is a pain medication. Yes. But the stuff that we have on the street is synthesized fentanyl, so it's made.
Yeah, so which makes it a lot dangerous because you can't meter something that's man-made, right? So in the hospital, they have dosages and milligrams that you can give to patients, and they'll be okay with it. But also in the hospital, when they give someone a medication that has fentanyl in it, they send them home with Narcan.
So when you think of an overdose, part of the reason why an individual overdoses is because polysubstance use, meaning more than one substance. So if a person is taking, say you're sitting at home and you're maybe drinking wine, and somebody said, hey, well, let's use a Percocet because it helps relax you, and maybe you start smoking marijuana or something like that, what is that? That's polysubstance use, and a person could be what? In an opportunity where they can have an overdose. But what we are finding that they're putting fentanyl in almost everything now. So as far as the street is concerned, you're finding fentanyl in club drugs. You're finding fentanyl in crack and crack cocaine. You're finding fentanyl in heroin. So the wide usage of fentanyl is really so varying that you almost have to have Narcan with you.
Can you tell me how would someone use one of these kits to check if the drugs they receive have, traces of fentanyl in it?
So this is the fentanyl drug testing strips, and we train people how to use them all the time. We'll tell an individual to take a piece of their substance that may be like the size of a grain of rice or smaller, right? They'll put it into this cup. You'll add the water to the cup, and you have the testing strips, right? So once you open the testing strips, You'll take the strip and you'll sit it into the cup with the substance.
Can I ask you one question?
Yes, sir.
Prior to doing this, is there anything about the substance that shows it may be off? Can you tell that something is different from this than the last time you had it?
No, sir.
Okay.
Well, I'm not going to say for what the people on the street see, but for us, there's really not a way to tell. We always tell people, test your drugs, right? Because we believe in harm reduction. And the first rule of harm reduction is you got to have a non-judgmental approach. So if you tell me that you want to use heroin, okay, you're an adult. Your choice, your body, your decision. That's what harm reduction is. Who am I to tell you what you shouldn't use? There's a million people telling you on a day-to-day basis, well, you shouldn't do this, you shouldn't do that. That turns a person against you when you're trying to help them. So for me, I want to say, you may be using, but if you don't want to use fentanyl, don't use fentanyl. Test your drugs. We don't push abstinence because that can turn people against you, right? If I tell you, hey, Jacoby, I don't think Sprite is good for you, man. You shouldn't drink Sprite anymore. Just kick it cold turkey, and I love Sprite. But if I tell you, man, try to do it in moderation, right? Have a cup today, a cup tomorrow, instead of having a 2-liter. That's the way that we try to get you to step back from it. And also it opens up other doors as well. So while you taking the stuff from the Sprite, man, let's worry about it. Let's get in the gym a little bit more, right? Right? Let's drink more water. So there's always other options, but we tell people to test your drugs because it's very important. If you don't want to use something, don't use it.
So when you use the strip, can you just put it in regardless of what form it's in? Do you have to add a liquid or anything, or can you just...
Well, yeah, so the kit comes with a liquid, right? And we put it in the liquid. So the time that we were having the conversation, that's usually the time it takes, anywhere from 2 to 3 minutes. If you see one line, that means it's positive for fentanyl, right? If you see 2 lines, that means it's negative. And that's how we teach people to test. Now, we have other testers that we use. We also have one, the Defent one that we use, which is different than this. I can show you that one as well. But this is a way for us to teach the community on how to properly take care of themselves. And education is key. So when you educate people, they can educate others and educate others and educate others. Before you know it, you have a whole bunch of educated people who are just making the right decisions.
Before we move on from fentanyl, there are so many, you see these like kind of scare stories about like, oh, if you touch fentanyl, like you can overdose. Like, oh, if there's even a little bit, like you can overdose. Is there any truth to that? Like, obviously it's very powerful and it's a lot more powerful than say heroin or some other opioids. But, you know, is that level of exposure, you know, is it really that bad?
To be honest, we were always told and through studies that it takes a grain of rice, 2 grains of rice is what it takes for a person to overdose off of fentanyl. Now, there have been stories to where there were police officers who touched it and overdosed, but those came back to be not true. So I don't want to say no, and I don't want to say yes either, because it depends on how you're handling it, right? I don't think the average person is just running around handling fentanyl all day with no gloves and no mask or whatever the case may be. So just like with anything that can harm you, you have to protect yourself.
How can you tell if someone is experiencing an overdose? Because I imagine for some, maybe with or without training, maybe that bystander effect kicks in. They start overthinking the situation. They don't know if they should step in. So what are some of the signs people should be looking out for?
The most important sign of an overdose is unresponsiveness. That's what you look for. There is other signs such as clammy skin. You may see blue tint around the lips. But the most important thing is a person being unresponsive. So, Rich has come up with something for us at the task force. This is something that we use, and it's called a shake, rub, and call. Shake, rub, and call method. And this is how we identify if a person is unresponsive, if not, all right? So if I call your name, Jacoby, you'll respond, right? Yeah. You're responsive. But if I call your name and you don't respond, you're unresponsive. Now, if I call your name and you don't answer, that's when I can do the shake, call, and rub method, right? I'll shake you, call your name, and I'll rub you in a vigorous manner, be it under the nose, the arm, somewhere that'll agitate the body.
What we've done was we determined that because you're down or you're in a position and you're not responsive. So we shook, we rubbed, and now we're going to call 911.
And what we try to teach people is that you don't use the word overdose. It's a epidemic. And if you use that word, it scares people, and it also turns people away from providing help, because everyone thinks that an overdose is linked to illicit street drugs, and that's not what it is. We say unresponsive because we want to give the individual on the ground a real chance of living. We want to give real services, and we want real people to come out and do their job. So if they hear someone is unresponsive, they want to react a little quicker than saying, hey, we have someone overdosing.
You mean when you call 911, you specifically tell the operator this person is unresponsive instead of I think this person is having an overdose?
Yes, ma'am.
So it starts with two things. So we want to always, when we see a situation, say if a person was on the ground and they were unresponsive. So what we want to do, we always tell what we want to do is we want to analyze the area first and make sure, see what's going on. The person could be on the ground, they could be bleeding out. So we always want to look at the circumstance first. The second thing, or first and or second thing you want to do is you want to calm yourself down. And then for the method is we want to always check. So that's why we utilize the shake, rub, call method. So if a person is on the ground, so we've looked at the situation, we've kind of calmed ourselves down, then we go through that whole process. Shake the person, call the person, and that's the initial concept of recognizing if a person is actually an overdose. If we shake that person and they get up, then they're not an overdose. Right. They're probably in what's called a drug stupor, which they're just kind of out, and you see people kind of going back and forth like that. Or you see people on the street and they're kind of like leaned over and things, leaning over, things like that. Those individuals are not an overdose. They're just in a stupor. And we never administer Narcan if a person is not actually in overdose, where they're actually not responsive and not breathing. Because if you administer Narcan to an individual who is just in a stupor or just kind of out of it, but they're still alert, they can become sick. So we don't want that. So that's why we want to make sure all the time that the person is actually not responsive, not breathing.
Maybe we can go through the Narcan.
So this is naloxone. This is naloxone, and this is the injectable version, right? So all naloxone works the same, basically. It's a blocker, and it's for opiate overdose relief, right? Or reversal. With the syringe, we usually have these vials here, and they're about 1 milligram, right? Versus this in the nasal spray, which is 4, right? This works for some people a little faster than a lot of others would say.
Well, the needle, what it is that when you're using a needle, you're getting a little bit more direct access. When you're using the Narcan nasal spray, it works through absorption. So it just takes, they both work fast. This just works a little faster.
Is it something about the situation that's dictating which one you should be reaching for?
We use mostly the nasal spray. We use mostly the nasal spray because the complication sometimes is that people are not knowing how to utilize a needle, and sometimes it could be a little scary for people to use the needle, and then also to train someone to use a needle. It's a little bit, so this is just a little bit easier to help individuals with.
Since you've already made the call, what you'll do is take the nasal spray up the nostril, right? It's 1 squirt. After you've administered the medication, you want to put the person into the life-saving position. So after you've already gave it to them, you want to put them on the left-hand side. And so in case they happen to regurgitate, it goes out and it doesn't go in. Now,
Are you saying roll them onto their side?
Roll them on the
Got it.
left-hand side. It's the life-saving position. Standing, you want to bring them down and put them onto the left-hand side. And at that point, you're giving the medicine time to work. So it takes 2 to 3 minutes. So within 2 to 3 minutes, if you don't see normal signs of life come back into the body, and normal signs of life is a twitch, a kick, a sound, a breathing, just to let someone know that, hey, I'm back. If you don't see that, then
Someone
you want
trying to get their bearings.
And then you want to take the second dose up the next nostril. And once again, 2 to 3 minutes. So
When a person is using opioids, and then we'll just talk about the brain a little bit. So there are receptors in the brain. The opioid actually sits on the receptor in the brain. So this is a blocker. And what happens is when we utilize the Narcan or naloxone, what it does, it travels to that receptor and it removes the opioid off that receptor and it sits on the receptor. Now we're administering Narcan. Now we're going to wait and we're going to observe. We're going to step back. We're still going to rub check. Hey, sir, come on, get up. Come on, man, get up. Let's get you up. And we may shake them a little bit, things like that. Maybe do what we call agitation and kind of just rub, shake them up a little bit. And a lot of times you'll see people, they'll start to respond and you actually see them start coming back.
How do you maintain good relationships with other first responders, EMT, police, other people who may also be arriving to the scene, but you've already started to take control of it in some respects?
If someone is overdosing and we've done our part, when medical services get there, we're out the way. We're deferred because we're not medical professionals. They are. When they come, we're done.
The way our job works, and what we teach people to do is we have to be that in between until emergency services arrive. So what's the main reason why you think people die from overdose? There's a couple of reasons.
No one intervenes fast enough.
Intervention. So there's part of the reasons are when a person's having an overdose, what impacts the major organs of the body. So the body's shutting down. That's the main reason. Number two, intervention. So between use and intervention, that's why we stand in that gap. Because if someone's used, we don't know when they've used. We don't know how long they've been in that state. And then if help is here and we're here, our job is to provide that life-saving support until the individuals who may have the greater help or have the greater assistance arrives.
I had one very specific question about the spray. Because when I think of like Flonase or like an allergy medicine, I'm thinking, I have a feeling
take the breath in.
You got to take the breath in.
I got you.
Right. So do you not need to be breathing for the naloxone to work?
So what I had mentioned earlier, I love this question because like a person asked me that the other day or some time ago. They said, wait a minute. Yeah, I do. They said, Rich.
My allergy medicine.
They say, Rich, wait a minute. Now you just told me part of the thing is a person is not responsive, not breathing. If a person is not responsive, not breathing, when you take a nasal spray, Afrin or something like that, you have to breathe it in. Well, the great part, again, that's why I call this technology, it works through absorption. So what it does, it absorbs in the nasal passage. You saw the demonstration of the spray. It really gets into the nostril, really absorbs into the membrane, and then once that absorption process happens, then it finds the receptor. Yeah. So the model that we try to really follow is, especially with Narcan, it needs to be every home, every neighborhood, and every community. And why is that, Sinky? Why do it needs to be in every home, every neighborhood, and every community?
Because it is a life-saving tool. That's what Narcan is. Narcan is a life-saving tool, and it should be in every home. Narcan should be just like toothpaste. Everyone should have it in their medical cabinet because the issue isn't just coming from the street. The issue is coming from the latest stats saying that children 13 through 16 are dying more than ever from fentanyl-related drugs and things of that nature and overdose. So when we get this life-saving tool in the community and we train people how to use it properly, we're hoping to save lives. Not just that life, but what about the countless other lives that can be saved from proper training? And also we have safe for use kits, right? So a safe for use kit, what most people may call it a pipe, right? We call it safe for use kit because this is a way to safely protect themselves, right? When people share utensils, that can cause a spread of disease. So when we use the safe for use kits, we use these to not just give to people to use, but to also help start a conversation. So if I give you a safe for use kit today, right, and I see you tomorrow, let's have a different conversation, right? So whatever you were using, have you used today? What is it that we can do for you today? What is it that we can do for you the next day besides providing you with safe for use materials?
These kits don't have, I think, as I see, hypodermic needles, but there are places in Chicago that do clean needles as well, correct?
That's correct. One of those places is CRA. They offer Chicago Recovery Alliance. They offer clean utensils, safer use. A lot of people will ask for syringes, but there's also a syringe van that comes around and delivers new ones and takes the old ones with sharps containers and things like that. So it's just giving a person the opportunity to stay clean, keep themselves from harming themselves in any additional ways. You know, for people who are injecting, if they use the same old syringe, infection can set in, or they can cause a larger other problems. So we usually try to just provide what it is that people may need, so to keep themselves from harming themselves any further.
So a lot of times people use that term that we're enabling people to do the drugs instead of preventing individuals. So I'm glad when people use the word prevention, is because we're actually helping to prevent spread of disease. So if we're helping prevent spread of disease, it really is prevention. And I think for exposure on a community level, you would want people to use clean needles, because what it does, it cuts down risk.
Besides the task force, where are some other places people can find resources for harm reduction? I know Narcan kits are popping up in vending machines and the library. So where are some other places in the city people can get access?
You mentioned a couple. So library, City of Chicago, they have various places that they have things set up. You see that box over there. There are several boxes. There are in different locations.
So it looks like a newspaper box.
Yeah,
or
it looks like a newspaper
box.
or magazine box. And then also this summer, we were actually very, I can say, a lot of good work that went into getting Narcan vending machines on the CTA line, CTA train lines. So we have, like, I think 5 different lines that we have boxes on that have Narcan in it. So an individual can go to that box and free, no stigma. They can go select whatever, make their selection, and take what they need out of there, as much as that. And those boxes get replenished weekly.
I saw it for
daily.
the first time a few weeks ago. I was taking the Green Line to go to the Austin branch of the public library, and I saw my first one.
Oh, okay, cool. So you should go grab one out of there one day just to make sure it's working right.
That's a good suggestion.
And then also, about 5 years ago, the Chicago Public Libraries decided to go ahead and put out the different boxes that they use to hand out Narcan. So and then also a lot of the community agencies and a lot of the churches. So we do trainings at different churches and different agencies. And one of the things that we also suggest is that they carry Narcan too. So you have a lot of different agencies that are on the West Side. They also carry Narcan as well.
Got it.
One of the next levels is universities. If you ever been through a university, you know what that's like. I don't need to explain all that. But there are a lot of drug use that goes on, and polysubstance use that may go on. And we find that I was talking to my grandson who goes to DePaul, and we were having a conversation about Narcan, and he was like, "Well, wait a minute, we should have that on the campus. That needs to be on the campus." And he was kind of really offended that he didn't see any Narcan on his campus. And I said, well, you can do something about it. And then when you know better, you can do better. So I said, now you can do something about it. So I gave him some, and he started talking to some of his friends, and they were all just like, man, we need this. So
yeah. I mean, I grew up in the Just Say No, in the DARE era. And, by the time I got to college, ultimately what we felt was unprepared to have realistic conversations about what was happening in our communities back home, but also happening on campus.
Well, I think that's what sets like an unrealistic expectation to tell someone just say no. Because if you're dealing with kids, tell a kid just say no. I want to find out why. I want to find out what you're telling me no. I want to find out what this is all about, so I can see what this is, so I can see why you're telling me to say no. So that's why you have to give a little bit more information than just to say no.
And it also just taught me the options were yes or no. Not test or have nuance or think about it.
Or this is the reason why you should say no. The reason why, because what? And remember, this is your brain on drugs?
Yep.
Yeah. It's like, why are you inundating us with that? Let us know why. And I think people want to know. They want to know the real. And they don't want to just be told something or just be told not to do something. I think it is, you tell people why.
For someone who is listening, how do you impart upon them that this is not just a West Side problem, though it is in the name, right? This isn't a low income problem. This is something our entire society, our entire city is dealing with, and we all have a part to play in this. How do you convince someone to sort of get off the bench in this conversation?
I'm going to be honest with you. Just watch the news. We just lost a great producer, director, actor to what? Son had mental health issues and substance use disorder. So it just doesn't affect Black and brown people. It affects everybody. This issue is so varying and so wide, it touches everyone. So I've been in the substance abuse disorder world for many years now, and I've never only come across just a certain type of people. I've seen every range of individual and have listened to stories and heard individuals talk about how their family had money and how this and how that and how this and that. So it really does impact the multitudes more than people think. Now, the face of it may be the black and brown individuals or the people on the West Side, but this thing is it's everywhere. Substance use disorder is everywhere. It impacts every family, it impacts every community, and it impacts every socioeconomic status. So again, Narcan is for every home, every neighborhood, and every community. And it doesn't matter where it is.
Again, we're reporting live from the West Side Heroin and Opioid Task Force offices on the west side off Pulaski and Lake. I want to give another huge thank you to Richard Vargas. Thank you for making time. And CQ Adams, we appreciate you sitting down, my brother.
Thank you. It's my pleasure being here. Thank you.
Before we get out of here, I got some good news for you. Art Therapy is back this Sunday at 7 p.m. at Life Score Foundation off 84th and Cottage Grove. They're going to have sound bowl meditations, yoga, an open mic and jam session, coloring books, food vendors, and more. I'll drop a link for you in the show notes. Make sure you're also following along with our daily newsletter and you bookmark our website, chicago.citycast.fm. We're going to be back bright and early tomorrow. I'll talk to you then. Peace.